Hello, my name is Jenna Lynn. I'm going to be your student nurse today. Could I see your wristband, please? And could you give me your name and your date of birth?
Keisha Satowski, 12/29/98.
Perfect. And Keisha, have you voided or gone to the bathroom in the last few minutes?
Yeah.
All right, you don't have to pee right now?
No, I'm good.
Perfect.
Bladder's empty.
All right. And I can see that you already have your hospital gown on right now, so we'll go ahead and get started with your assessment. I'm going to start with your pulmonary assessment. So I'm going to have you sit up for me. And I'm going, is it okay if I lower your gown?
Oh, yeah.
Okay, and I'll have you swing your legs over the edge of the bed here and face me. Perfect. Okay. I'm going to assess your abs, your chest. I'm going to palpate it for any crepitus, masses, thrills, and everything feels normal. All right, and then I'm going to percuss her chest. Okay, let me go under here. Go on this side. And up here. Alright, everything sounds good. Going to check for your diaphragmatic excursion. Make sure that your lungs are both expanding equally. Could I have you take a deep breath in? Good. One more time. Perfect. Alright. I am going to listen for your lung sound. So I have you breathe in deeply. Good. 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 Don't want you to hyperventilate, so just take it on your time. There you go. Good. One more time. Good. Perfect. Once on this side. Good. Sounds. Good. And two more times. Once here and one time up here. You have good breath sounds. I don't hear any gurgling or anything in your lungs, so it sounds like your lungs are clear. All right, and I'm going to have you turn around for me, and I'm going to assess the back side of your chest. Move your hair out of the way. I'm going to palpate for, again, any masses or crepitus, and I don't feel anything. Everything feels all right. Do you feel any pain or tenderness?
No, that's very nice.
Okay, perfect. And I'm going to do diaphragmatic excursion on the back as well. Can I have you breathe in? Good, even on both sides. All right. Actually, I'm going to palpate first before I auscultate. Good. Gonna auscultate. I'm gonna have you do the breathing in again. Good. Again. Good. Oh, that was a good strong one. Again. Good. Good. 3 more times. Good. All right. The last thing I'm going to do is check your diaphragmatic, I believe it's called diaphragmatic excursion, right? Okay. Yes. All right, I'm going to have you breathe in, and I'm going to hold it for me. I'm going to percuss. Right there. the lowest point. Okay, you can let your breath out now. Sorry about that. And then I'm going to have you just breathe a little normal right now. And then when you're ready, breathe out and hold it. Okay, definitely down here. Okay, go ahead and release your breath. Go right there. And I'm going to do it on this side too, so breathe normally. And then breathe in as hard as you can and hold it. Try it here. Okay, let it out. Sorry. Alright, and then I'm going to have you breathe normally, and then breathe out and hold it. So right here. Okay, breathe normal again. Go ahead and measure those. Okay. Good. Perfect. All right. And I'm going to have you turn around again. All right. And you can go ahead and put your gown back on. And the next thing I'm going to do is assess your cardiovascular system. And lay down, relax. I'm going to bring your gown down. All right. You comfortable? Mm-hmm. All right. Going to palpate first for your second right intercostal space for your aortic. Good. And then I'm going to move straight across to the left second intercostal space for the pulmonic. And then third intercostal space. Good. Also known as Ebb's point. And then I'm going to lift your bra for a second, and I'm going to do your fourth intercostal space. So the tricuspid. Good. And then the last one is the fifth intercostal space, and that would be your mitral. Good. And then the precordium of your heart. I'm going to palpate it here in the left sternal border. And while I'm doing this, I'm also assessing your chest for symmetry, color. Everything looks good. I don't see any scars, masses. I didn't feel anything while I was palpating. I'm going to go ahead and listen to your heart. And this is a cardiac stethoscope. So when I put it down lightly on one point, it's going to be using the diaphragm. I'm going to be listening to your heartbeat. Then I'm going to put some pressure on it, and then it's going to switch to the bell of the stethoscope, which will allow me to hear the thrills in that area, or if there are any thrills or bruits or anything like that. Okay, so I'm going to start again at the second intercostal space at the aortic. So I'm listening with the diaphragm. Good strong heartbeat. Press in a little bit. Ooh, very nice. No bruits. Move over to the second left intercostal space. That's the word I was looking for. Listen to the heartbeat. Press in a little bit for the bruits. See if there are any. Don't hear any. Good. And the third intercostal left space. Good heartbeat. Press in here. Use the bell. Nothing abnormal there. I'm going to lift it up a little bit. I'm going to listen to your fourth intercostal space. Good heart sounds, and then push in to listen for any bruits. Everything sounds good there. And the fifth intercostal space is the mitral. Listening to the heartbeat, which is very strong here. Push in and listen for buoys. Everything sounds good. All right, and now I'm going to move on to your abdominal assessment. I'm going to cover you up, and then I'm going to expose just your abdomen. And I'm going to get a pillow and place them under your legs. So if you could, yes, perfect. Raise your legs. I'm going to put this pillow under and just relax. Good. All right. You have good color in your abdomen. Hair's growing the right way. I don't see any masses just by looking at it. No scars, no bad coloring. Everything looks even. I'm going to look for symmetry to make sure that your belly button is lined up with your nose. And it looks like it is. Perfect. All right, the first thing I'm going to do is I'm going to auscultate your abdomen. I'm going to listen in all 4 quadrants, starting with the right lower quadrant. I'm just going to be listening for how active your bowel sounds are. I would say hypoactive bowel sounds in this quadrant. I'm moving to the right upper quadrant. Normal bowel sounds in the right upper quadrant, moving to the left upper quadrant. I'd say in between normal and hyperactive bowel sounds. Here in the left upper, and moving to the last quadrant, left lower. And I'd say hypoactive sounds for the left lower quadrant. All right. The next thing I'm going to do, actually, I need this again, is to auscultate your different arteries. So I'm going to start with the aortic artery. Good, I can hear that. And I'm going to also listen for bruits by activating the bell. I don't hear any bruits. All right, I'm going to do the right renal artery. Good, good sounds. The left renal artery. Femoral arteries. Good. The right iliac artery. Good sound. And the left iliac artery. Now I'm going to percuss your abdomen in the same pattern of the quadrants that I did before, starting with the right lower quadrant. And here I'm looking for any abnormal dull sounds where there shouldn't be. Make sure there's no masses. I don't hear anything. In the right lower, moving to the right upper quadrant. Good resonance. Right up where your liver should be, there's some dullness, which is good, which means your liver is in the right place. Moving over to the left upper quadrant. Good resonance down here. A little bit of dullness up in here where your spleen should be, which is good. And I'm ending in the left lower quadrant, and I'm not hearing any dullness. And do you have to pee at this point? Is it okay if I percuss your bladder? All right. Okay. Good. Perfect. All right. Next thing I'm going to do is palpate those 4 quadrants just to feel for any. I'm going to start with light palpation. Just going to feel just any abnormalities. Everything feels smooth in the right lower quadrant. The right upper quadrant, Good. Left upper quadrant. And the left lower quadrant. Don't feel anything abnormal. Good. And I'm going to palpate a little bit deeper into each of the 4 quadrants. No abnormalities there in the right lower. I'm moving to the right upper. Don't feel anything abnormal here, which is, of course, a good sign. Moving to the left upper quadrant. Left lower quadrant. You feel any pain or tenderness anywhere with this? All right. Good. All right. I am going to attempt to assess your liver span. So what I want you to do is I want you to breathe out, and I'm going to feel the very bottom of your liver. First, actually, I'm going to palpate. Actually, this is palpating for to see whether your liver is. We want to feel a firm liver with no nodules on it, because you have a healthy liver, and I feel a firm liver. Smooth. It's good. All right. Now I'm going to progress your liver span. I'm going to start up here, and I'm going to move up. Resonant. Stay right there. Okay. Right here. I'm going to measure that. Good. The liver span is normal. You can go ahead and put your bra down. All right. And the last thing, let's see. Last thing I'm going to do is I'm going to have you sit up, and I'm going to press your costal vertebral angle. And let me know if you feel any pain with this. I'm going to put my hand over your kidney area, and I'm going to pound on my hand. Do you feel any pain?
No pain.
Good. Perfect. All right. I'll have you lie back down. And I have completed your abdominal assessment. Is you feel okay? Everything feel good?
Mm-hmm.
All right. I will be back. And let me know if you need anything. The button's right here.
Jello.
Jello. Okay.
Hi, my name's Alex, and I'll be your nurse today. I'm going to be doing an abdominal and gastrointestinal assessment on you. Can I have you go ahead and verify your name and your birthday?
Madison Chumley, 11/21/2002.
Okay, and I'm going to wash my hands. All right, I'm just going to have you lay back for the exam for me.
Like this?
Yes. I'm just going to lift up your shirt, okay? And I'm just inspecting general appearance here. She doesn't appear to be in any kind of stress. Are you having any kind of pain right now?
No.
Okay. And now I'm just inspecting your abdomen. I'm looking at color. Color looks good. Just making sure that everything's in alignment here, and we're good in that aspect. And then your breathing is controlled, and there's no use of any accessory muscles while we're breathing, or abdominal muscles. Okay, now I'm just going to listen to your bowel sounds. Sorry, it's cold.
Are my bowels moving?
All right. And bowel sounds are normoactive, so everything's working the way that it should, between 5 and 30 seconds apart. And I'm also going to listen again, but this time I'm going to listen with the bell of my stethoscope, and I'm listening for any kind of arterial bruits. So I'm going to listen at your aortic, and then renal and iliac down here. Make sure I have my bell. Okay, and I don't hear any kind of bruits there. And then next I'm going to listen to your renal. That's over here on this side. And nothing there. And then I'm going to listen to your iliac. I'm just going to place this down here. Sorry.
Come on, delete that.
All right. And I don't hear any kind of bruise or anything
I
abnormal.
feel so exposed.
So now I'm just going to listen for a venous home to see if I can hear anything. And I'm going to listen with the bell of my stethoscope again. And I'm going to listen right here, right below your belly button. I don't hear anything there. So then I'm going to go ahead and palpate. So I'm just going to lightly touch here around your stomach. So I'm just feeling for any kind of tenderness. Sorry, my hands are cold. I'm not
More than the stethoscope.
I'm sorry. Does any of that hurt here when I'm pressing on your stomach? Okay. So I'm just looking at muscle tone. Feels good. Everything feels good. Okay. And I'm going to see if I can feel any masses. So I'm going to push a little bit harder this time when I press. All right. I don't feel any kind of masses. And I don't see any kind of aortic pulsation, which would be me seeing visibly that pulsation right here. So that's good. Okay, and I'm just going to palpate just the rest of your stomach. I'm going to palpate down here and then around your umbilical. I'm really sorry. My hands are so cold. All right, and everything feels good and muscle tone is great. And then I'm going to have you sit up and I'm going to percuss and see if I can feel your kidneys back here. So go ahead and put your shirt down there. Just going to see if I can feel them just right here.
I'm ticklish.
Sorry. I don't feel anything. I don't feel them bulging or sticking out at all. So everything looks good there. All right. And do you have any questions for me?
Nope.
All right. Well, I'll send the doctor in.
Okay. Thanks.
Okay, hi, my name is Riley. I'll be your student nurse today, working with your regular nurse. I'm just going to be performing a brief assessment, and do you have any concerns or questions before I get started?
Nope.
Okay, so I'm just going to read her vital signs. I have a little card with them on it. So her vital signs were 36.7 for her temperature, 14 for her respirations, 67 for her heart rate, and 112/76 for her blood pressure. All right. On a scale of 0 to 10, how would you assess your pain? 0 being none and 10 being extremely painful.
0.
Perfect. So, before we get started on our assessment, I'm just going to ask you 3 questions. What's your full name?
Natalie Murray.
Perfect. What's today's date?
The 23rd of October.
Yep. And where are you right now?
A bedroom.
Perfect. So, clearly my patient is awake, alert, and oriented to time, person, and place, which is all very good. To get started. So I'm going to start with your neurological assessment. So I'm just going to grab this. Oh, not to mention, since she is answering my questions with no speech issues or anything like that, we can tell that her mental capacity is clear and appropriate. So I'm going to be testing Perla right now for her first part of her neurological assessment. And I'm going to be testing constriction and accommodation. So for constriction, I'm going to shine my light in one of her pupils, and I'm going to watch for that pupil to constrict. And then when I do it again, I'm going to watch for the other pupil to constrict, and then I'm going to do it to both sides. All right, so just look forward. Perfect. Awesome. And just one more time, or 2 more times. Wait. Very good. Okay, so every time I shine the light, when I was looking at her direct eye, the pupil constricted, which is good on both sides. And then when I did it and looked at the other eye on both sides, the pupil constricted. So this is a good finding for constriction. Now we're just going to be testing accommodation. So I'm going to have you look at my pen light, and then look at the wall behind me, look at my pen light again, and look at the wall behind me one more time. Okay. And then at the wall, then at the pen, and at the wall. Very good. So again, when she looked up close at my pen, her pupils constricted. When she looked at the wall behind me, she had dilation. So this is a good finding for accommodation. Next, I'm just going to be assessing your grasp. So if you could just grab my 2 fingers with both of your hands and squeeze as hard as you can. Very good. So her strength is clearly a 5 out of 5. Very good, nothing wrong with that. And it was symmetrical on both sides. Now I'm just going to be having you do some facial movements. So can you just raise your eyebrows? Can you flare your nostrils? Can you puff out your cheeks? Stick out your tongue? Wiggle it from side to side? Perfect. So she had symmetrical movements on her face on both sides, and she had no drooping or anything, which is a very good sign for that test. Next, I'm going to be moving on to your cardiovascular assessment. So in order to do that, I'm just going to listen to your heart. And again, when I took her heart rate the first time, she had a normal rhythm. Nothing was wrong with that when I took her vitals. So if you could just take a deep breath in and out for me. First, I'm going to listen to your aortic. Good. And then your mitral. No. Excuse me. Your pulmonic. Good. And your tricuspid. And lastly, your mitral. I'm just going to scooch up your shirt. Very good. So her heart sounds are very clear, very normal, no murmurs. And now I'm just going to listen with the bell of my stethoscope. And just listen to the tricuspid and mitral valves. I'm just going to listen. Perfect. So again, that was listening for S3 and S4. No murmurs or nothing was wrong with that. Now I'm just going to be testing your dorsalis pedis pulse and your posterior tibial pulse. So if you could just lay all the way back for me. So first I'm going to test your dorsalis pedis pulse. Awesome. Cool. So they were a 2 out of 3 on both sides, which is very good. And onto her posterior. I'm just going to go on the inside of the ankle here. And just throw the foot. Good. Again, a 2 out of 3, equal on both sides. So that looked really good. Next, I'm just going to move on to your skin. So if you could just sit up for me again. Perfect. So first I'm going to assess the color of your skin. She's clearly Caucasian, so she's fair, pale, which is all very normal finding. Next I'm going to do sensation. So I'm just going to have you close your eyes. I'm just going to poke you on a part of your body, and you could just tell me what part of your body that is.
Arm.
Which arm?
Oh, right arm.
There you go.
Left arm. Left leg. Right leg. Tummy. Chest. Neck. Forehead.
Perfect. All right, so sensation was clearly very good. So color and sensation were good. Movement, I'm just going to have you wiggle your toes for me. And roll your ankles. Wiggle your fingers. Roll them out. Your wrists. Perfect. So clearly her movement is also very good. So this is a good finding. And there's no edema. Nothing was wrong. She looks good. Next, I'm going to move on to her pulmonary assessment. So I'm just going to start by saying her respiratory rates were within normal limits. It was a 14, and she's clearly not in any sign of respiratory distress and has no labored breathing or any difficulties with that. So first I'm going to auscultate you anteriorly. So if you could just take deep breaths in and out. So I'm going to start by doing your right apex. Breathe in. Oh, actually, I'm going to switch back. All right, breathe in. All right, left apex. Good. Left upper. Right upper. Left upper. Right upper. Good. Now I'm just going to do you laterally. So I'm just going to have you face the wall this way. So I'm doing her right side. So I'm just going to have you lift your arm above your head. Perfect. So I'm going to do right upper, right middle, and right lower. Good. And can you just do the same thing on the other side? Left upper, left upper, and left lower. Good. Okay, I'm going to do her posteriorly, but before I do that, I'm just going to say that all of her breath sounds were clear to auscultation, and there was no adventitious breath sounds, and it was bilaterally, so she had no problem. They were symmetrical on both sides. So I just want to say that before I do posteriorly. Okay, posteriorly, I'm going to do left upper, right upper, right lower, left lower, right lower, right lower, and then left lower, right lower, and left lower. Good. Again, no clear auscultation, no adventitious breath signs, and this was these findings were bilaterally. So next, I'm just going to assess your abdomen, or your abdomen. So if you could just lay back for me. I'm going to ask you a few questions before we get started. So, are you having any trouble passing gas?
No.
Have you had any recent bowel movements?
Yeah.
Okay. And was this soft and formed, your bowel movement?
Yeah.
Yep. Okay. And then are you having any problems with nausea or vomiting?
Nope.
Okay, perfect. So I'm just going to assess your abdomen. So the abdomen's split into 4. So I'm going to listen first for your bowel sounds. So this is your right upper quadrant. Your left upper quadrant. Your right lower quadrant. And left lower quadrant. Sorry. Perfect. Okay, so she had active bowel sounds. There's nothing wrong with that. They were not hyper or hypo, which is all good. And now I'm just going to palpate your abdomen in 4 spots again. She's really ticklish, so she might laugh, but I'm going to try my best. Okay, I'm just like, I'm not even going to press. I'm going to pretend like I'm pressing. No, I'm going to press. Right. Okay, good. I'm sorry. Okay, perfect. Okay, so her stomach was non-tender, non-distended, but soft. That was all very good. You can sit up for me again. Now I'm just going to ask you some questions again. Are you having any pain, frequency, burning, or urinary retention issues?
No.
Okay, sounds good. So if my patient was in the hospital and had a Foley catheter in, we would be seeing 30 cc's of urine every hour, but clearly she does not have one in right now, so she's all good. Next, I'm just going to look at your skin again. So I'm looking for mobility, sensation, if there's any breakdown, any friction areas, anything like that that could cause any problems. And I don't see any, so her skin looks really good. That also looks good. So lastly, I'm just going to give you a little bit of a patient teaching point. So obviously in the hospital I would have this printed out, but I have it on my computer here, and I'm going to be teaching her about a breast exam. So I'm going to, if this was in the hospital, I would give her the pamphlet or the papers that I have, and I would just go over all of them basically, and the one that I have up basically is just giving you step by step how to look in the mirror, how to touch your breast, and how to feel for if there's any lumps, any drainage, anything that looks wrong basically, which is all very good just to make sure, everything's right there, and like if there were to be anything that you could catch it early, anything like that. It's going to tell you who to contact and what to do if you do find any lumps or anything along those lines. But yeah, so that's about it. And then I'd ask her if she had any questions, answer her questions before she would leave, anything like that. So yeah, that's about it.